All right, here we go again. Welcome, everyone, to another special edition of our live Q&As for this World Glaucoma Week. We've got another fantastic talk tonight. This time, the subject matter is about holistic approaches to glaucoma management. And the title of the talk is Proactive Glaucoma Care, Have You Done Enough? So before I introduce our special guest speaker, let me just talk a little bit about Dr. Ang's background. So Dr. Brian Ang is a glaucoma subspecialist and comprehensive ophthalmologist specialising in glaucoma management, cataract surgery, and the treatment of macular degeneration and diabetic eye disease. He's highly experienced and skilled in performing complex glaucoma and cataract surgery, as well as minimally invasive glaucoma surgery, which is often known as MIGS. Brian currently holds a public appointment as a glaucoma consultant at the Eye and Ear Hospital in Melbourne, where he takes an active role in training registrars and fellows. Apart from his clinical work, Brian is also active in clinical research and holds honorary positions as a clinical senior lecturer at the University of Melbourne and a clinical researcher at the Centre for Eye Research Australia, also based in Melbourne. So thank you very much, Dr. Ang, for joining us. We're really, really looking forward to the session today. So why don't I hand over to you and maybe you can get into your presentation.
That's great. Thank you so much, Richard, for the introduction. And I also would like to thank the rest of the Glaucoma Australia team for putting on this wonderful event. Good evening, everyone. It is a real pleasure and privilege to be here. And this evening, I'd like to share with you my thoughts on proactive and holistic glaucoma care. And whether you are someone with glaucoma or you are at risk of glaucoma or you simply want to look after your eye health naturally, then the next 20 to 30 minutes should empower you with the necessary information and knowledge to be able to make the best decisions for your eye health based on your own personal circumstances. So what exactly is proactive glaucoma care? Because most of you probably wouldn't have heard of it before. Well, this is because it is a term that I coined myself. And it is really describing the taking of proactive action to address and manage glaucoma risk naturally through holistic lifestyle measures. As someone who is at risk of glaucoma myself through my family history, I want to know that I have done everything that I can to reduce my own risk of developing glaucoma. And the way we do this is by incorporating what I call the 5 key pillars of proactive glaucoma care into our daily routine consistently. The 5 key pillars are physical activity, stress management, sleep, diet and nutrition, and finally, neuroprotection. Now, neuroprotection can be a controversial topic, and this is because there is no specific medical consensus or clinical guideline on this. Nevertheless, I will share with you my insights on neuroprotection based on my clinical experience and analysis of current available scientific literature. Let's dive in. So the first key pillar is physical activity. We all know that exercise is really good for our body, but it is also really good for our eyes. From a glaucoma point of view, doing exercise actually helps to temporarily reduce eye pressure. It improves blood flow and microcirculation to the eyes, optic nerves, and brain. In other words, the entire vision ecosystem. Research has shown that people who exercise more and for longer have much slower rates of visual field progression compared to those who exercise less. So the aim here is to do moderate to brisk exercise for at least 30 to 45 minutes daily. So jogging or cycling or swimming, these are all great options. With swimming, it is a fantastic non-weight-bearing aerobic exercise, but the key consideration here is with regards to the swimming goggles that you wear. researchers from Perth have found that swimming goggles with a small internal diameter can actually elevate your eye pressure when you wear them. So the advice here is to wear swimming goggles with an internal diameter of greater than 52 millimeters, because this has very little or minimal impact on eye pressure. With exercise, the main concern is with strength training, and this is because it can cause sometimes very dramatic elevations in intrathoracic pressure. There have been reports of eye pressures increasing by up to 40 millimeters mercury during weightlifting. So, if possible, try to slowly exhale during periods of maximal exertion instead of holding your breath in. So this is a little bit like releasing the pressure valve in a pressure cooker, and this should reduce the amount of pressure elevation when you lift heavy weights. Another option could be to do more repetitions with lighter weights instead of less repetitions with heavier weights. Another activity that could increase eye pressure is playing high resistance wind instruments such as bagpipes and the trumpet. The research has shown that high resistance wind instrument musicians actually suffered greater visual field loss compared to those who played low resistance instruments. And the amount of visual field loss that they developed was actually related to how much time they spent playing that particular instrument. So if you've got glaucoma, and particularly if you've got advanced glaucoma, you may have to consider reducing the hours of playing high resistance wind instruments. And when we talk about activities that can elevate eye pressure, yoga certainly comes into mind. Don't get me wrong, yoga is a fantastic physical activity to undertake. It improves blood circulation, improves core strength, improves mental well-being. It has so many benefits. But the inverted positions can definitely elevate eye pressure, including the downward dog pose. And the research has shown that the eye pressure can increase by up to 10 to 20 millimeters mercury. So the key here is actually to adapt your yoga postures so that you are not bending down so much. So you may have to work with an experienced yoga teacher who can help and guide you to adapt your postures accordingly so that you still derive the benefits of yoga but without causing the significant pressure elevations. Now, the second key pillar is managing stress. Stress is really not good for your body and not good for your eyes either. I actually feel that stress is criminally overlooked when it comes to our eye health. Stress can cause your blood pressure to increase. It can increase your cardiovascular risk. It can also increase your eye pressure. And while we can't live a life of no stress, we can certainly take steps to manage this. And one of the best ways to manage stress is through mindfulness meditation. Clinical trials from India has shown that if you are able to perform mindfulness meditation for 45 to 60 minutes every day, it could potentially reduce your eye pressure by up to an additional 25% on top of what you have already achieved with your eye drops. Another great way of managing stress is through this 365 breathing technique or deep breathing. In this technique, 3 times daily, you should take 6 breaths every minute. So this means you take 5 seconds to inhale and 5 seconds to exhale. Doing this can reduce your eye pressure by an average of around 2 millimeters mercury. The third key pillar is sleep. Now, sleep is very important for your general health and for your eyes. This is when your cells get to rest and rejuvenate themselves. And so, in the context of glaucoma, too little sleep is not good, but so is too much sleep. So what you want to do is aim for 7 to 9 hours of uninterrupted sleep. Try not to sleep with your affected eye facing downward into the pillow. And if you've got sleep apnea, make sure that is treated and managed appropriately. And this is because people with sleep apnea have a 10 times greater risk of developing glaucoma compared to someone who does not have sleep apnea. The fourth key pillar is diet and nutrition. We all know that eating a healthy diet with lots of fruits and vegetables will be really good for your general health, but it is also going to be really good for your eye health too. For glaucoma, people who consume more fruits and vegetables compared to those who don't have a 79% less likelihood of developing glaucoma. So the message here is clear. Make sure you eat lots and lots of fruits and vegetables. And if you can adopt the Mediterranean diet, then that would be excellent. Dietary omega-3 fatty acids have also been linked with less likelihood of developing glaucoma. So where possible, increase your intake of cold fatty fish such as sardines and wild trout. Do this 3 to 4 times every week. And interestingly, hot tea may also help to reduce your risk of glaucoma. A study from America found that drinking a cup of hot tea every day was correlated with a reduced risk of about 74% of developing glaucoma. It has to be hot tea though, so iced tea won't work and decaffeinated tea won't work. Now, this study did not specifically specify the type of tea or the cup size or the brewing time. So what this means is that for now, you are free to enjoy your green tea or chai or Darjeeling or whatever brew it is that you enjoy drinking until more clinical data comes to light. Now, speaking of brews, coffee is actually not so good from the point of view of glaucoma. And this is because it can temporarily increase eye pressure from between 1 to 6 millimeters mercury. And data from the US has found that if you already have the genetic risk of developing glaucoma and you drink a third or more cups of coffee a day, then you expose yourself to potentially a fourfold increase of developing glaucoma. So this is quite significant. Now, on the other hand, with alcohol, it could potentially reduce your eye pressure, but too much alcohol could actually cause toxic optic neuropathy. So with coffee and alcohol, the advice is to drink it in moderation. So 1 to 2 cups of coffee a day will be fine, and 1 to 2 glasses of wine a day should be fine too. Now, with foods, what you put in your body is important, but also what not to put in your body is equally important. And everybody knows what the foods to avoid are. So avoid foods with high refined sugar content, high saturated fat content, high salt content, high calorie content, etc. So you know what to do. I want to specially mention smoking. Smoking is probably one of the worst things that one can do for their general health and also eye health. Smokers have a 70% risk of developing glaucoma compared to non-smokers. And not just that, smokers also have increased risk of other sight-threatening eye conditions, including macular degeneration, uveitis, and retinal vascular occlusions. So if you do smoke, if you can, please cut down, or if possible, even stop completely. And the final key pillar is neuroprotection. Now, neuroprotection is something that researchers and scientists are very interested in. And this is because with glaucoma, while eye pressure is the main risk factor for progression, it is not the only risk. There are other key biocellular risks and mechanisms that also contribute to glaucoma damage. And it makes sense that these risks and mechanisms should also be addressed and managed appropriately. So, what are these 10 key risks? The first, of course, is eye pressure. Without doubt, the most important risk factor. Studies have shown that certain nutraceuticals are able to reduce eye pressure in glaucoma patients in the order of 1 to 3 millimeters mercury. And these include saffron, the combination of bilberry and maritime pine bark, and palmitol ethanolamide. The second factor is mental stress, and we've already covered that in the second key pillar of proactive care. Nutraceuticals that have been shown to clinically be able to benefit stress include saffron and the macular carotenoids lutein and zeaxanthin. The third factor is homocysteine levels. Now, homocysteine is an amino acid that is naturally present in the body as a byproduct of amino acid metabolism. So everyone will have certain amounts of homocysteine in their body. But when homocysteine levels are high, that is a problem because this can cause damage to the blood vessels that supply the eyes, the brain, and the heart. So this increases the risk of cardiovascular disease and stroke. And from the eye point of view, it also increases the risk of pseudoexfoliation glaucoma. The link with other glaucoma types is a little bit less clear-cut. There are vitamins that are able to reduce homocysteine levels, and these include the methylcobalamin form of vitamin B12, methylfolate, and pyridoxine or vitamin B6. This leads nicely to the fourth factor, which is vascular dysregulation. This is where the microcirculation and blood flow to the eye and the optic nerve are impaired. And as a result, this increases the susceptibility of the optic nerve to glaucoma damage. This is particularly important for normal tension glaucoma patients. The two most well-known nutraceuticals for ocular microcirculation are ginkgo biloba and bilberry. The fifth factor is mitochondrial dysfunction. Now, the mitochondria are the engines of the cells, and the mitochondria require the coenzyme NAD+ to be able to perform its metabolic activity efficiently. As we grow older, our levels of NAD+ deplete naturally. And from the context of glaucoma, reduced NAD+ in the retinal ganglion cells reduces mitochondrial function, and this will accelerate retinal ganglion cell death. So to boost NAD+ levels in the retinal ganglion cells and improve mitochondrial function, one can take the nicotinamide form of vitamin B3. Hand in hand with mitochondrial dysfunction is impaired glucose metabolism. When eye pressure is elevated, glucose metabolism and glycolysis are impaired. And this results in depletion of cellular pyruvate levels. And this series of events occur prior to optic nerve degeneration. So it makes sense that if we want to increase cellular pyruvate levels and restore the normal glycolysis pathways, then we could supplement with pyruvate. The downstream effects of mitochondrial dysfunction and glucose metabolism deficiencies are oxidative stress and chronic inflammation. These two go hand in hand, and they cause an increase in damage to the retinal ganglion cell, either through free radical damage or immune-mediated reactions. So if we want to mitigate the impact of this, we could consider taking nutraceuticals with powerful antioxidant and anti-inflammatory activity, such as ginkgo biloba, bilberry, and grapeseed. The ninth factor is axonal degeneration and failure. The axons in the retinal ganglion cells are critical because they transmit visual information from the retina to the brain. In glaucoma, there is degeneration of the axons, resulting in axonal transport failure. As a result, it is very important that we protect and support the axons. And the nutraceuticals that can help with this include methylcobalamin, methylfolate, and citicoline. Unfortunately, citicoline is not something that is available to be purchased in Australia. And finally, macular pigment deficiency. Macular pigment deficiency is typically associated with age-related macular degeneration. However, the research nowadays increasingly recognizes this as an important factor for glaucoma. The macular carotenoids, lutein and zeaxanthin, will help to absorb harmful UV light and blue light and also protect the macula from oxidative stress. This will help to preserve central vision, color vision, and contrast sensitivity. All of these are important visual functions that will also be adversely affected by glaucoma. So after all of this, the next question I get asked a lot by my patients is which neuroprotection risk to address. And as I alluded to earlier, there is currently no medical consensus or specific guidelines on neuroprotection. So, as someone who is at risk of glaucoma myself, I personally choose to cover all the 10 biocellular mechanisms and risks. Ultimately, which risk to address, what nutraceutical to take, how much to take, and how long to take it for, is your decision to make after you discuss this with your eye care professional. Now, I can't emphasize this strongly enough. Regardless of what nutraceutical you decide to supplement with, these must not replace your existing prescribed treatments. So, in summary, holistic glaucoma care goes beyond just using eye drops or having laser treatment or undergoing surgery. It's about embracing positive lifestyle choices to improve your eye health over the long term and reduce your glaucoma risk. The blueprint for holistic glaucoma care success lies in the 5 key pillars, which encompass physical activity, stress management, sleep, diet, and neuroprotection. So this concludes my presentation for this evening. I would like to thank you for your time and attention. If you have any questions, please feel free to ask through the live Q&A or even email me at the address shown on the slide. Thank you.
That's fantastic, Dr. Ang. Thank you so much. I mean, I think there are a lot of things there that will get people thinking. I think for me personally, it felt like there were some wins there and maybe some losses with things that I quite like and quite enjoy, like alcohol and coffee, for example. But you know, a lot of those things will be make total sense to people around the importance of exercise, the importance of eating effectively, stress management techniques, all of those sorts of things, and very much where the nutraceuticals piece comes in. There's still a lot of evidence that will no doubt be uncovered in the years ahead, and we've certainly heard a lot about in Australia the work being done around vitamin B. So you know, that's something that's being done even in your own backyard, I believe, at at your own institute. So why don't we turn over now to some questions from our viewers. So first and foremost, what's the relationship between eye health and blood pressure?
That's a great question, Richard. So high blood pressure is associated with a variety of sight-threatening eye conditions, including hypertensive retinopathy, retinal vascular occlusions, ischemic optic neuropathy, and diabetic eye disease. So it is an important risk factor that needs to be managed for overall eye health. Now, in the context of glaucoma, elevated eye pressure is indirectly linked with eye pressure. So in general, if your blood pressure is high, then your eye pressure will also be high. However, low blood pressure, especially nocturnal blood pressure, is also a risk factor in its own right, especially for normal tension glaucoma. So this means that for glaucoma patients, and glaucoma suspects, both high blood pressure and low blood pressure will need to be addressed and monitored for.
Fantastic. Thank you. And what about the relationship between eye health and cholesterol?
Yeah, so similarly to high blood pressure, high cholesterol levels are also associated with vascular eye conditions, including retinal vascular occlusions and diabetic eye disease. However, in the context of glaucoma, there is no direct link that I know of, but potentially a high cholesterol level could lead to increased retinal venous pressure, which in turn increases the risk of a retinal vascular occlusion.
Brilliant. All right. Fantastic. Thank you for that. All right. Question from Rajiv. I would like to have Dr. Ang's views on treating glaucoma with Chinese acupuncture. There's a growing movement of highly skilled specialists in Chinese medicine who treat various eye diseases through acupuncture, and was clear to say that this does not involve putting needles in the eyes. And apparently they've done some clinical trials at Johns Hopkins Hospital in the US with good results. So what do you know about that?
Well, this is a really interesting area. But firstly, I wanted to say if we did put needles in the eyes, that could be an effective treatment to reduce eye pressure, but it's not recommended. I think the results are really quite promising. The way it works is not clearly understood at the moment because with traditional Chinese medicine, it's all about the overall health and also the meridians of energy. So with Chinese medicine, they want to look at what areas you're deficient in and they try to improve that. And so with the studies that they've done in America, I really am looking forward to receiving more data before I'm able to sort of recommend to my patients to please go for acupuncture.
Okay, brilliant. All right, question from Bodhi. What role does homeopathy play in the treatment of glaucoma?
Yes. As far as I know, based on my reading of the literature, there hasn't really been any evidence for homeopathy in glaucoma treatment. However, if you do know of any data or studies on this, please feel free to share with me and I'll be happy to look into it.
Great, thank you. Okay, question from Wendy. Have there been any studies on the impact of nicotinamide plus ginkgo biloba on open-angle glaucoma? And are you able to suggest a recommended dose?
Yes, so firstly, niacinamide is also known as nicotinamide, which is vitamin B3. So if you are asking specifically whether the specific combination of nicotinamide or niacinamide with ginkgo biloba in open-angle glaucoma, then as far as I'm aware, there is no specific combination of that nature. Individually, there has been quite some body of evidence to show a benefit of both with nicotinamide because it helps to reduce mitochondrial dysfunction. It has been shown to be able to reduce to improve inner retinal function in glaucoma patients. With ginkgo biloba, because it helps with vascular dysregulation, it has been shown to have the greatest impact for normal tension glaucoma patients. So in terms of doses, with ginkgo biloba, I would say at least 120 milligrams daily. With nicotinamide, it is a little bit unclear at the moment, because the trial that showed a benefit actually used a really high dose of 3,000 milligrams daily. And my own clinical experience with my patients is that not many of them could tolerate such a high dose.
Mm.
And that trial was only for a short duration of 6 weeks. So my personal feeling is that potentially, if you could reduce the amount of nicotinamide that you take daily, but take it over the long term, you should still get similar benefits. But this is just my hypothesis, and I don't have any clinical data to back this up.
All right, thank you. We're right on 7 o'clock now, so we've been going for 30 minutes. So I'll probably take one more question. Question from Rosamund. Which of the 5 pillars, if you had to choose one, do you think is the most effective for glaucoma? I know it's probably like getting to choose between your children. You love them all, but is there one that just makes more sense than anything else to really focus in on?
I think that, okay, to be honest, I would say please focus on all 5, because otherwise I would just present one key pillar and
Yes.
rather than 5. But if you had to choose one, I think it would really depend on your personal circumstances. So for instance, if you know that you eat really badly and the rest of your lifestyle is good, then focus on the diet and nutrition aspect of it. Or if you live a very sedentary life, but the rest of your health is okay, then maybe you focus on the first pillar of exercise. So I'm sorry, I can't really be more specific than that.
No, I think that's a very good answer. I mean, and it's a really nice way to finish a session like this. At the end of the day, we're talking very generally here, and obviously you're talking about the evidence base that exists around the world, but there's really no substitute for you going and speaking to your doctor about your own specific personalized situation, and they're always going to be the best people to advise you on what's really going to work for you. So listen, I'll probably take an opportunity now to thank you very much for making the time. Fascinating presentation. I think you've come at it from a really sensible perspective. I certainly learned a lot through the session. I hope everyone watching on at home learned a lot as well. And I'll also just take an opportunity just to promote our own site-wise patient support program while I've got everyone on the session. So you can access advice. You might have questions about your glaucoma around things that weren't covered in the session today. And you can access our clinical educators at any time on 1-800-500-880, or you can go to www.glaucoma.org.au and enrol in our site-wise program. I'd also like to take the opportunity to thank our wonderful sponsor of all of our live Q&A sessions. They wouldn't exist without the support of Glaucus, so thank you very much, Malati and the team. I'd also like to thank our GA staff behind the scenes that make these things possible, particularly Satna and April. So this is not our last live Q&A this week. We've actually got another one this Thursday at 6 p.m. Eastern Daylight Saving Time. And it's going to be a very, very interesting personal glaucoma story. So make sure you do tune in. So listen, thank you again, Dr. Ang, for your time. It was a fantastic session. And thank you, everyone, and look forward to seeing you again on the next one.
Thanks very much, Richard. Thanks, everyone.